Hey, my friends. Welcome back to the High Performing Dental Team. I'm Dayna Johnson, your host. And if you listened to last week's podcast, you were in for a treat because I had a special guest, Katrina Sanders, AKA the dental wine genist. And we talked all about perio in your practice. And, she works in a very high perio practice. She's in a perio practice. She works in the surgical suite. So she is very well in tune with periodontal disease. And so she talked a lot about percentages. And one thing that we talked quite a bit about was how you can get your perio percentage in your practice. And whenever I am doing an assessment, so I love to remote into your software and do I call it a practice audit, where I go in and I look at all your reports. I look at how you're scheduling. I look at your clinical documentation, and I can get a lot of really good information just by looking around at your software. And so one of the things that I always look for is the perio percentage. And if you listened to our podcast last week, Katrina and I talked quite a bit about how low the percentage is in most dental practices. And so for those of you that maybe shy away from, reading studies or surveys or anything like that, the ADA did a study with the AAP a few years ago. I guess it's probably been about 6 years. So I'm sure the percentages are much higher than they used to be. But back then when they did this study, 49.2% of adult Americans had some version of periodontal disease. So what I would expect to see would be percentages somewhere between 20, 30, 40% of perio in your practice, especially if your practice is in the South. Southern Americans have a higher rate of periodontal disease than other parts of the country. And so my Southern clients, I would expect your perio percentage to be close to 50%. However, what I typically see, in fact, I've had a couple offices in the Atlanta area, and I remember working with this doctor. This was a couple years ago, working with a doctor, and their perio percentage, I think, was like maybe 1 or 2%, which means that they were only billing out 1 or 2% in periodontal therapy and perio maintenance. And I also couldn't find any perio charts. And so that was another thing that Katrina and I talked about last week, was the lack of diagnostic information in your practice. And so it really, I wanted to expand on my conversation from last week and give you a little bit more information about how you can determine what your perio percentage is. And then maybe you can start to diagnose, why is our perio percentage so low? And so first place is, how do I even find my perio percentage? So it's super easy to do. All you have to do is, it's a basic calculation. You just add up the number of times that you have billed out a particular procedure code. I always just do it over the last 12 months. You can go to your practice analysis report. You can search for the codes. So you need the D1110, which is the pro fee, the D4910, perio maintenance, D4341, and D4342 for perio scaling and root planing. So you add up the total number of the quantity. I don't care about the dollar amounts. I care about the quantity. Like, how many times have you actually posted that procedure code to a patient ledger over the last 12 months? So you add up all those numbers. And then what you do is you get a total. You add up all those numbers, you get a total, and then you just add up the perio numbers, the 4910, the 4341, and the 4342. And then you divide those numbers together and you get a percentage. Okay. So most of the time when I'm doing practice audits, I typically see the perio percentage less than 10%. That's an average. Now, I have seen as high as 31, 32%. I don't think I've ever seen it higher than that. And so this office I was working at in the Atlanta area, their perio percentage was like 1 to 2%, and I couldn't find any perio charts. So I had a conversation with the doctor, and I'm like, "What's going on? Like, what is happening?" And he's like, "My hygienists, they say they don't have time. They don't have time to do the proper diagnostics in order to diagnose periodontal disease." And so my conversation with the doctor was, well, we either need to find them time, okay, or I can't work with you. And it was a deal breaker for me. I mean, it really is, because if your clinical team is not taking the proper diagnostics, then that is a responsibility where you're failing your patients clinically. And you shouldn't be in dentistry. You shouldn't be treating people in healthcare if you're not willing to take the proper diagnostics. And so when I got to the practice, of course, we started looking at ways that we could implement perio charting into the hygienist's normal routine. And we'll come back to that in just a second. But there are 3 reasons why your perio percentage might be low. Okay. The first reason is it's very possible that your team is just not diagnosing. And it can come from many places of your mindset. It could be that you're afraid that patients will leave the practice if you diagnose periodontal disease. Or it might be that, patients that have been coming to you for years and years and years, they've been coming to you as a pro fee, and your hygienists have been treating them as a pro fee. And you're like, oh my gosh, this patient has periodontal disease that we've been treating like a pro fee. And what's going to happen when I talk to them that they have periodontal disease? A lot of patients, they don't even know they have periodontal disease because it doesn't hurt. Maybe their gums bleed when they floss, or maybe their gums bleed when they brush. But a lot of times people think that's normal. And, since periodontal disease is a painless disease, a lot of times patients really don't think that it's true. And so that's why having the proper diagnostics gives you the tools that you need in order to educate patients about what's going on in their mouth. And one of the things that I loved about what Katrina said last week was use the word your as many times as you can when you're educating patients about their disease. So if you want to hear her verbal skills, please go back and listen to episode 106 with Katrina Sanders. It was phenomenal. And she gives a lot of really good ways that you can talk to patients and talk to your team about diagnosing perio. So like I said, there's 3 reasons why your perio percentage might be low. Number 1 is you're not taking the diagnostics because either there's a lack of time, or you don't have the team in order to make that happen. Maybe you need to have an FMX or vertical bite wings or a pano or you have to have the diagnostics. You also have to have the perio charting at least once a year. And so if we are needing to develop that into your workflow, it might be but that you just don't have the staffing to do it, or you don't have the technology to do it. Okay. So if you don't have the technology or the staffing to do diagnostics, then we really have to be looking at what can we supplement into your practice. Okay, there are some really good voice activated perio options now. Dentrix has Bola AI. It is a voice activated perio chart process. You just talk to it, you just speak to it, and it fills out the perio chart for you. It also can write your clinical notes for you. So you could supplement your staffing if you're short staffed and you don't have someone that can come help your hygienist do the perio charting. Then you could supplement that with an AI process or with a voice activated charting system. And then if you need someone to take x-rays, then dental assistants can take x-rays. If the hygienist doesn't have time, you can always have an assistant. Maybe have the patient come in a little bit early if they need an FMX. So there's ways that you can get the diagnostics. So stop using the excuse that you don't have time, because that's what was going on with this office I was working at in the Atlanta area. The hygienist said, I just don't have time. And it's like, well, we need to make time. And what we did find out, if this particular practice, I don't know what about your practice, but with this particular practice, the hygienists were actually doing a lot of administrative tasks that we could have eliminated from their workflow. If you have to choose between perio charting and scheduling the patient's next visit, I would choose perio charting in a heartbeat. Okay. And so if you have to choose between some other administrative tasks I'm not saying that those are administrative tasks, but what I'm saying is that the hygienist, you are skilled and you have workflow processes that are only you in the office can do that. You are the doctor. Like, you are the only person in the office that can perio chart other than the doctor. Your dental assistants can take x-rays for you, at least I think in most states. And then, maybe you can get a dental student to come in and maybe help turn rooms over or whatever. And then you can supplement your workflow with AI processes or voice activated charting. So those are definite. So no more excuses that you don't have time to do perio charting, because you must make time to do perio charting. And then the second reason why your perio percentage might be low is lack of diagnosing. And of course, if you don't have the diagnostic tools to diagnose, then you're not going to be able to diagnose. And so this comes back to the mindset of diagnosing periodontal disease, especially if the patient has been in your practice for quite a while and you've been treating them as a pro fee. And now you're like, oh my gosh, we cannot treat this patient as a pro fee any longer. We have to diagnose. We have to get them on board with periotherapy. Now that's going to be a really challenging conversation. And you might have to learn some really good verbal skills to do that. Katrina Sanders is probably one of the best in the business as far as verbal skills are concerned. So you could definitely reach out to her personally to do that and come in and coach your team. I've also seen offices that have had the periodontist in their local area come in and do training with your team. So your local periodontist, I have an office here in Highlands Ranch, Washington, or Colorado, and they had the periodontist that they refer to for surgeries and implant placements. The periodontist actually came in and did several lunch and learns with their team and helped them to learn how to diagnose, talk to patients, sell treatment, and all of that. So you can work with your local specialists in your area, and they'd be more than happy to come in and help you ramp up your periotherapy in your practice. Okay, third is why your perio percentage might be low is that you might not be coding correctly. Okay, so this really comes down to, and I hate to say it, but this is insurance fraud if you're not coding correctly in your practice. So if the hygienist has taken the proper diagnostics, the hygienist has diagnosed periodontal disease, or your doctor has diagnosed periodontal disease, the patient is scheduling the treatment and the perio maintenance, but then the front desk is coding it as a pro fee or coding it as preventative so that the insurance will cover it. That is a big no-no. Okay, that is insurance fraud. You will get in trouble. You will get if you get audited, the doctor will be in huge trouble. So we do not want to put your doctor's license at risk by coding it just so your patients can get insurance coverage. Okay, so if you want to code it as perio, which the patient needs. You're treating the patient for perio, and you code it as perio, and it's perio maintenance, and the patient gets 3 pro fees per year, and you're coding it as perio maintenance, you can always ask for an alternate benefit. So either in the remarks for unusual services or as an attachment to the claim, you can always ask for an alternate benefit. And then maybe the insurance company will still pay for the pro fee. They'll downgrade the perio maintenance into a pro fee. So the patient can still get some benefit, but you're not committing insurance fraud by not coding it correctly. So those are the 3 reasons why I find that the perio percentage is low in your practice. And so there's a couple things that you can do to move forward. You might be thinking like Dayna, I don't know what to do. Like, where would I go from here? Well, what I would do is I would reach out to either your local periodontist, and your local periodontist can come in and do some lunch and learns with you. You can reach out to a hygiene coach. So there's some really good ones in our industry. Katrina Sanders is one of the best. Rachel Wall with Inspired Hygiene, she is amazing. And she also has a perio calculator worksheet that you can request. And it just makes the calculation so easy for you. You don't even have to do any math. All you have to do is plug in the numbers, and it works really well. And then if you have more questions, please reach out to me. You can comment on our podcast. You can send me an email. You can book a call with me. I look forward to helping your practice. And I look forward to following along in your journey of becoming a high-performing dental team. All right, my friends, if you liked this episode, I know it was fast, but wanted to tack on a little bit more detail from our talk last week. If you found this episode informative and enlightening and educational, please rate it, review it, give us a 5-star review. That's how we are able to get this podcast out to more people. So I hope you have a great rest of your day, and I look forward to watching your journey of becoming a high-performing dental team.